If you are a man watching this video, chances are your testosterone levels are below what they should be. But it's not just you. Testosterone levels across generations are at an all-time low. Research shows that recent years have seen a substantial and as yet unrecognized age-independent population level decrease in T in American men. As of right now, we don't know the cause of this alarming epidemic, but it is alarming news because testosterone is the primary male sex hormone and an anabolic steroid which is responsible for much of our health as men. In this video, we will take a look at how testosterone affects your body when it comes to building muscle and losing fat, the symptoms of low levels of testosterone and what you can do to bring them back up naturally and without drugs. Testosterone increases muscle mass and strength. A study by the Journal of Applied Physiology suggests that testosterone increases muscle mass by increasing muscle protein synthesis by 27% on average. The regulation of insulin, glucose, and fat metabolism is also closely related to testosterone levels. When your T levels drop below normal, your ability to regulate fat gain diminishes and your body begins to store more adipose tissue, which is especially common in middle-aged men and is usually known as a beer belly, despite the fact that beer is not the only culprit. The problem is further exacerbated by the fact that adipose tissue also produces estrogen on its own, creating a cycle of decreasing testosterone, common in overweight men. In addition, testosterone also increases libido and improves erections, increases bone density, and may fight depression, strengthen the heart, decrease your chance of Alzheimer's disease, improve cognitive ability, increase competitiveness, dominance, and the desire for power, and it may even help you attract and seduce a woman. In short, testosterone is pretty awesome. But how can you know if you suffer from low levels of this male hormone? Some common and easily spotted symptoms include constant fatigue, feelings of sadness and depression, brain fog, and loss of libido. If you have one or more of them and suspect you might be low on the T, consider going to your doctor and getting a test that will give you a definite answer. Fortunately, there are a few ways of increasing your testosterone levels without resorting to hormone therapy or steroids. So how do you increase testosterone? First of all, you need to get enough sleep. You heard that right. You don't need pills. You need a pillow. Daytime testosterone levels were decreased by 10 to 15% in a study of young healthy men who underwent 1 week of sleep restriction to 5 hours per night, while only sleeping for 4 brings you close to borderline deficient. On average, your levels rise 15% for every additional hour of sleep. If you're not sure how much you should be sleeping, between 7 and 10 hours is best, depending on your activity during the day. In conjunction with sleep, managing your stress levels can also improve your testosterone levels. Stress raises the level of cortisol, a catabolic hormone that has an inverse relationship with testosterone. When one rises, the other falls. The key to lowering it is reducing repeated stressful situations in your life, as well as developing positive coping mechanisms like deep breathing, meditation, or practicing yoga. As we said before, your diet is an important part of keeping your testosterone at a healthy level. If you are overweight, losing fat will increase your testosterone levels. Additionally, studies have shown that a diet rich in fats can help elevate your levels. Since testosterone is produced from cholesterol, it makes sense that higher levels of HDL, the good cholesterol, can improve your T levels. High-intensity exercise has also been shown to have a positive effect on the male hormone. Resistance training is not only one of the best things you can do for your body and health in general, it is also a great way to bring up your T levels. Research has found that strength training can induce growth hormone and testosterone release, regardless of age. Protocols high in volume, moderate to high in intensity, using short rest intervals and stressing a large muscle mass tend to produce the greatest acute hormonal elevations. That means that you will get the best results using exercises like squats, deadlifts, presses, rows, chin-ups, and dips. On a more surprising note, if you are a heterosexual man, even a short conversation with a woman can boost your testosterone. A study found that the increase in testosterone levels was related to how much the woman in the conversation thought the man was trying to impress her. Just a 5-minute talk raised the hormone levels by 14%. So go say hi to that girl you like. If nothing else, it will give you a testosterone boost. To conclude, testosterone levels are on a decline. But if you are experiencing any signs of a deficiency, there are natural ways to increase it. It is also important to remember that high levels of testosterone are not the best. Optimal levels are. However, regardless of your current levels, getting enough exercise, sleep, and a proper amount of food will improve your life far beyond a simple increase in your testosterone.